Hello and welcome to another episode of Close Calls with California Poison Control. Today we're going to be talking about the drug fentanyl, which has gained a lot of notoriety in the media, especially over the last several years, as a recreational drug of abuse. Fentanyl, of course, is a well-known pharmaceutical drug, but it has been accelerating in terms of its use as a recreational drug that sometimes is illegally synthesized out in the world, and people are getting a hold of this, and we see a lot of bad outcomes with tens of thousands of deaths per year all over the world. We have today a couple of experts who are going to talk to us about fentanyl. My name is Dr. Cyrus Rangan, a medical toxicologist with the California Poison Control System. And we have with us today two emergency physicians and toxicologists who will be talking about this problem of fentanyl. We have Dr. Craig Smolin, who is the medical director of the San Francisco division of California Poison Control, and Dr. Race Vora, who is the medical director of the Fresno Madera division of California Poison Control. Welcome to both of you.
Thank you.
Thanks for having us.
Dr. Vora, I wonder if you could give us a little bit of an idea about the general problem that we have with fentanyl out in the world as a recreational drug of abuse, the kinds of formulations that are out there, what people are getting into and why.
Sure. Yeah, this is quite a concerning trend. We've known about fentanyl in medicine for many decades. It's used as a painkiller. However, in the last few years, it's being found more and more on the street. It's contaminating the street drug supply. People that might be using drugs that they obtain from drug dealers on the street might be getting it thinking that it's an opioid, such as OxyContin, but they might also be getting it if they try to use something like methamphetamines. So it's really being found all over in the street drug supply. The other issue is that it's not really well controlled in that environment. First of all, whenever we give fentanyl in the healthcare system, we're always watching the patient's demographics, like their weight, their other medical problems, and also their oxygen level. So it's a very controlled use of fentanyl. Out in the street and in people's homes, you don't have any of that. And at the same time, the amount of fentanyl that's being found in these street drugs really varies. So from pill to pill and batch to batch, people just don't know how much fentanyl is in there. And that makes for a deadly combination. So that's what our law enforcement partners and what we find on the poison control side. We've seen a lot of tragedies as a result of the fentanyl that's contaminating the supply of opioids, methamphetamines, really anything that's being sold out on the street.
So to your point, it sounds like people may be out there seeking something like fentanyl as a drug of abuse, but people also may be seeking other drugs, and fentanyl may be along for the ride as a contaminant, and they don't necessarily know about it, and then we have a potential bad outcome from it.
Exactly.
All right, so that sort of speaks to that sort of widespread prevalence of this problem. Dr. Smolin, could you give us a little bit of insight with California Poison Control's experience with this in terms of what we hear from people calling at home or from healthcare providers who have patients who have been exposed to fentanyl, how we go about treating it and the advice that we give, and maybe if you have a little bit of insight as to what the California Poison Control System is doing about opioid use disorder in general.
Yeah, thanks, Dr. Rangan. The Poison Center has really seen an explosion in the number of cases related to fentanyl over the past 5 to 10 years. And it's really become quite a problem, as was mentioned by Dr. Vora. The main issue is fentanyl is of course a pain medication. It's a very potent pain medication. And it's in the same class as other opioids such as morphine or heroin or oxycodone. These are all in the same class of medications. And unfortunately, while these medications can be really good at controlling pain, and we've used them for many, many years to control pain in medical settings, one of the important side effects of opioids is that they cause respiratory depression and essentially cause you to stop breathing. And that's really the danger of these drugs and medications. And so when we're in a controlled setting and we're using something like fentanyl, we monitor patients very closely. I think Dr. Vora mentioned we look at their oxygenation. We're constantly hovering over patients to make sure that we don't see any untoward outcomes. But when someone's using opioids like fentanyl, whether they know it or not, whether it's in their heroin supply, or it's in their cocaine or their prescribed fentanyl. When they're using it alone and in a non-monitored setting, there's always the risk that they'll stop breathing. And of course, patients have poor outcomes when they stop breathing. We do fortunately have a medication that can reverse the effects of all of these opioids. It's called Naloxone or Narcan, and it can be administered by a nasal spray. And one of the things that we have been doing through poison control and through our emergency departments and communities is to try to get naloxone into the hands of as many people as we possibly can. So when we prescribe opioids for patients who are in the emergency department, we will also give them naloxone. Or if someone has come in after an overdose of an illicit drug that we suspect was from fentanyl, we'll also prescribe them naloxone. So that's one of our harm reduction interventions.
And there's a lot of organizations that are ready to give free naloxone to anyone who asks for it, and that's very heartening. I think naloxone is certainly a very important intervention for opioid overdose. But again, it's not the only thing that's going to help this huge opioid epidemic. There's a lot of recovery resources, mental health resources, and something called medication-assisted treatment, which Dr. Smolin has actually been spearheading for us at Poison Control. All of which, if people have questions, they can call us at Poison Control, and we can talk to them about all of these different ways to help people with opioid overdose. But the key is we need everyone to know about naloxone and have it in their car, in their house, in their purses, backpacks, etc. Just because this is such a widespread problem. I really think of this like an EpiPen for anaphylaxis. Minutes and seconds do count, and we need everyone to be on the same page about when to use it and how to use it and feel very comfortable using it without stigma and without a doubt.
So it sounds like this is really just a rescue medication, if anything, and knowledge about it is probably the most important thing that we can put out there right now. And there may be state and local programs all over the country that you can get in touch with to make sure that you have that availability. And to your point, Dr. Smolin, about the availability, the widespread availability of fentanyl and why we're seeing so many of these cases and this explosion over the last several years, it seems that fentanyl really can be anywhere. Isn't that right?
Absolutely. Fentanyl can be in really any illicit drug that you can think of using on the streets. And so it's really important for people to be aware of that. And I do want to, I appreciate Dr. Bora bringing up other efforts for patients who are suffering from substance use disorder. And I think it's really a multi-pronged approach to this problem. Narcan being one of them, or naloxone being one of them. But I think it's really important for people to know that if they are struggling with substance use disorder, certainly there are other resources that we can point them in the direction of. And please feel free to reach out to the Poison Center for those kinds of questions as well.
Well, thanks to both of you for a great episode of Close Calls talking about fentanyl, and we look forward to talking to you about another substance in a future episode. Thank you very much.
Our pleasure.
Thank you.